next episode of the Soulful Eclectic. I'm your host, Diana Collins, and I want to welcome you to today's episode. I am the host, the creator of this podcast, and if this is the first time you joining us, I want to say welcome. If you have joined us before and you listened to a few episodes, I want to say thank you for your continued support, and I hope you share any of the content in the episodes with friends, loved ones who may need to hear it. So with that, we're going to go right into our next episode. Namaste. Hey everyone, welcome to the Soulful Eclectic. I'm your host, Diana Collins, and if this is your first time visiting me, welcome. If this is your return visit, thank you for coming back. I want to sing the theme from Golden Girls. Thank you for being my friends. Anyway, I can't hold a note to save my life, but it's okay. But anyway, today I wanted to talk about some healthcare issues and healthcare disparities that a community that's near and dear to my heart, and also one that I am a part of, that face on a day-to-day basis, and now due to overturning or changing of policies that have been put in place by Affordable Care Act when President Obama was in office, the Human Health Services has overturned or reverted back to an old law that gives people, not even people, I just want to say healthcare practitioners, the right to choose or turn away individuals that are that have lifestyles that go against their moral and religious standing. And being a lesbian female and a healthcare practitioner, that hurts my soul, honestly. For those of you who don't know me personally, in the light of love and peace and full transparency, I'm a lesbian female. I'm married to a transgendered male, and our community has always faced healthcare disparities because of the judgments that we're faced with day to day when we go into healthcare facilities. And I say that because I've seen every level of it's disrespect and lack of caring from healthcare professionals when delivering care to anyone in the LGBTQ community. It stems back to being a lesbian. My then wife, now husband, dressed in male clothes, men's clothes, if we want to even go there. And we go to doctor's offices together, and we'll walk up, they'll call his old name, and we'll both walk up to the nurse to go in, and they start talking to me. And immediately I'm looking at them like, no, do you not know who your patients are? Did you not read your patient's chart? And then my husband will just chime in and said, no, it's me. And they then have this, I call it the screw face look. They have this complete, like, duh look on their face. And it's just amazing how clear you can see their disgust once they've realized who their patient is. And some will apologize, some truly are apologetic about their behavior, but others really are just rude and just disrespectful about it. And I think this ruling will and has increased that level of uncaring and healthcare disparity within the community. Now, we already have a high suicide rate with our youth and older adults within the community because of the lack of support within not only outside the community but also within the community, which is really sad. And we see this in all communities. You know, the African American community, you have a section that are totally against you because of the way you live your life or have lived your life. And then you have a whole section of the LGBTQ community that doesn't accept you because you're transgender and you don't fit into that square box that they created, because now you've shaven off a few pieces of the side and you have more of a round shape than that square shape that you started out with. So the Human Health and Services ruling, everyone is actually part of a lawsuit that has been filed that that states that no human being should be turned away from having healthcare issues taken care of simply because of who they are and who they love. You know, and that's the biggest thing. And we've seen it for many years since Stonewall, before Stonewall. And it's just boggles my mind that we still have to deal with this on a day-to-day issue. On a day-to-day basis, excuse me. So with this, it's just really frustrating at how all the efforts that we've made to be included, to be respected, to get equal treatment is now being reversed. And this is not the only thing that we've seen or hear about being reversed. There's just so many things layered on. It's amazing. Like the other thing is the VA system and turning away and refusing to cover transgender costs for hormones and different treatments, not even including surgery, because they don't cover surgery, but hormonal treatment and things of that such. So this just gives that, I don't want to say, but I'm going to say it, that ignorant person more freedom to be ignorant and unpleasant and just mean and disregarding to human nature, human beings. So it just really just puts us in a place where we're going to have continued discrimination against human beings. So this Human Health Services healthcare discrimination ruling, it doesn't change the outside law, honestly, but it creates a lot of confusion and a lot of chaos where we once finally had clarity, right? We finally could see the light and see some resolution to a lot of these issues. So that chaos and confusion, now it gives everyone the right in these communities to, you know, disregard healthcare and not treat those within the LGBT community. And yes, you definitely go places where we're welcome with open arms and get treatment and everything will be great. But how many places are there like that within these small communities, little rural towns, okay, where, you know, you have people just coming out and voila, the only doctor you have is Dr. Phelps that's has an office behind the general store in a little town. Yes, I'm being a little facetious about what I'm saying, but there's still towns like that, you know, and in these towns like that, these individuals like me, first of all, I'm black, so I don't fare well in a little town. Personally, that's just my opinion. But to be gay or just to be gay and getting treatment in these little places is going to be hell. Right? So again, we got this lawsuit that's out there to help put things back in order. So in May, the current administration had again rolled back all these changes, and we have been fighting. If you haven't been watching the news or seeing your news feed on Facebook and things like that, you see rulings that have been going across through Supreme Court fighting sexual discrimination within the workplace. A lot of us have faced that. Not me personally, because honestly, no one truly sees me as living in the LGBTQ community, because now, again, my husband is transitioned over, so he looks like a straight man, and then that puts me in that category of being a straight woman. And I already, for what a lot of people say, you don't look like you're a lesbian. I don't know, what does a lesbian look like? Okay, so for the layman's purposes, I guess I don't look like the typical lesbian, so no one sees that within me. So I can usually get health care and get my issues taken care of fairly well until it gets to that point where they start asking about your sexual orientation, or how many kids you have, and there's just a series of questions that they ask you. And all these questions, they're now getting better, but previously all these questions were geared to heterosexual individuals. And it's been a journey, and in a continued journey, where we're getting to the point where we're making those changes so that the language fits the proper individual. And it also goes to everyone knowing who their patients are. When you have your patient come in, yes, you should review your chart. You may have a patient that say, hey, my name was Christina, but I go by Christopher. I would prefer you call me Christopher. And you see that noted in the chart, and you still call Christina to the office. And then, this big burly guy comes up to the desk and looking at you and, damn near ready to punch you in your face because you just called him Christina and his name is Christopher, right? And then also using the proper pronouns. What the hey? Okay, if you see that this person is identifying as male, how hard is it for you to change your pronouns? If you decide to, if you accidentally use the incorrect pronoun, correct yourself, for goodness sakes. It's just, makes me mad. But yeah, I'm going to get off of that tangent right now, because I can go on and on about it. And then because the other piece about it is, when you have someone who is, I'm going to just talk about transgender and transitioning. When you have someone that's transgender and transitioning, it becomes a psychological issue. You have to get psychological approval stating that you identify as female. And before you can have anything done, you have to see a psychiatrist. You have to get this paper filled out. You have to get this done. And I get it. They want to make sure that you are okay in your right mind. That's the medical person in me. But the logical person in me is like, this person has lived in pure hell within their bodies forever. This is what makes them happy, being who they are. Let's help them. Let's be that healthcare professional and help them and guide them through it. But no, we can't do that. But recently, in June of this year, the Human Health and Services had just published a ruling about the healthcare discrimination, which is now scheduled to be on the Supreme Court docket to have that reversed back to where it was, and not endangering lives. But the healthcare discrimination rule currently, as it stands, endangers the health and lives of many LGBTQ individuals and many in the transgender community. and also all sexual and gender minorities that this rule currently blocks. So, just an example, there's an article that was written just early spring when this came out. I think I actually read it before the actual ruling came out. The article came across as I was doing some other research, and I was flabbergasted because it was a pharmacy, a Walgreens and a CVS here in Arizona and Phoenix that refused to fill the hormones for two transgender individuals because they felt it went against their religious beliefs and refused to fill this medication. Now, anyone who's in the healthcare field knows that when you are on hormones to transition either male to female, female to male, you are on testosterone or estrogen for the rest of your life. And for someone to just refuse to fill your medication based on that, who are they to judge, right? And I'm sorry, what religion who just basically is gone against human life and saying, hey, you know what? I'm not happy with what you're doing, so guess what? I'm not filling this because I'm not happy. Or it goes against what I believe. It's an I thing and not a person thing. And being within the healthcare arena that I'm in the business of saving and preserving life at all costs, even if it is a procedure or a treatment that's elective. And the ruling is saying it's going to save we're obligated to save your life if it's in danger. Okay, well, you're endangering my life by not filling my prescription that's going to maintain my life. How about that? But again, I go off because it pisses me off to no extent. And it doesn't just piss me off because it's my community. It doesn't just piss me off because it impacts my husband or my best friend or anything like that. It pisses me off because I'm a healthcare professional and my job is to save your life, no matter if you like me or hate me for who I am. And you have the right to choose whether you're going to help me or not based upon, one, my color of my skin, and we're not even going to touch that today, but two, the fact of who I sleep with and want to share my heart with. Who you love is none of anyone's business. Their business is to be there for you, to save your life and keep you alive at all costs, or help provide you or supply you with the means to maintain your life. So looking back at it, the non-discrimination law denies, again, access to health care and services, right? The Human Health Services, once upon a time, did make some significant progress in protecting the rights of all of us and giving us all quality care. But and at one point it was recognizing the transgender population, but with those strides we've gone backwards. Even though we still have help with individuals who are living with HIV, we get their medications covered. We've made strides in allowing our same-sex partners to visit us or spouses to visit us and have rights with our healthcare, like visitation in the hospitals, and can get your family's benefits in the event that they passed away those kinds of things. But in equal opportunity, that's the most recent one that I was like, yes, finally, right? And then we just go backwards with that one. I don't get it. So right now, guys, that was just my little update on where we are with healthcare policies. And we have so many healthcare disparities. Healthy People 2020 has a whole list of healthcare disparities, starting with the LGBTQ community. Then we have the African American community, the senior citizens community. Oh my gosh, the list just goes on. And I think for America to be the greatest nation, we have the crappiest healthcare system and support around right now. And I'm just saddened by that. And hopefully, with our new administration that's coming in, that we can have some changes. If we get a new administration, I'm praying we get a new administration. And, my listeners can say yay or nay and, fight me on our current administration. I get it. You like who you like, but me personally, we need change. And, no one politician is perfect, but we need the lesser of the two evils right now. We really do. We need to get back on some footing and get ourselves back into a place where we love each other and we can be together in unity. So, I think one thing else I wanted to mention that it just came to me. The other thing about the healthcare disparities that I did want to mention out there that I feel like I'm empowered to share, that's why it popped back into my head, is that along with the healthcare disparities that we listed in Healthy People 2020 and the fact that we're being judged, we as healthcare practitioners and nurses and nurse practitioners and doctors, we're in the business of health prevention, healthcare maintenance. And one of the things that with the turning away of individuals who are transgender is that we're going to miss those preventative screenings that we can catch early to help prevent breast cancer, cervical cancer, and those issues. And I think that's what really is what's boggling my mind, because if I come to a primary care office and all of a sudden you see me and we're going through the paperwork and I'm telling you my history and you say, oh, you know what, I can't see you anymore because you're a lesbian living with married to a transgender straight couple, and it goes against my religion. Now, how prone do you think I am to going to go to another facility? I actually, am in the position where, yeah, I can do that. I can find a facility that works for me. But as I said in the beginning, some of these places don't have specialty, access to specialty clinics like I do. So now that person is not going to go into any primary care office to get any treatment for anything or get any screenings. So my point for saying this is that individuals who are transitioning female to male still need to have cervical, uterine, all those cancers, breast cancer screenings until they have their hysterectomy, but they still are prone to breast cancer. And guys, men do get breast cancer as well, straight men. It's about 2%, but it still happens. And then also with men transitioning to female, they still can get prostate cancer, right? So we still have to do those digital rectal screenings and all these things. So they're not getting this done because they're scared to tell you who they really are because they don't want to be judged. So now all of a sudden someone's going to have these series of symptoms and you're not going to know what test to do because you didn't build that bond with that patient because of your judgment and your lack of caring and compassion toward who that person is as a person, and not based upon their lifestyle. So so that's, I don't want to keep going, because I can definitely keep going off on a tangent on this one, because it boggles my mind how people who sign up to preserve life and save life pick and choose whose life they save and when. So on that note, I want to say to everyone, please love each other. Be in a space of understanding and peace. We may not like what everyone does, but honestly, who you lay down with at night really shouldn't be any of my business. So I appreciate you joining me today, listening, and please give your feedback. Share this episode if you will, and also join me again for the next installment. And I just want to wish you all love and peace and just wellness, all around wellness. So subscribe, like, send me a message. My email is at DC the Soulful Eclectic. It's DC at the Soulful Eclectic .com. And also you can come to my webpage, my Facebook page, Soulful Eclectic. And so I love you all. I wish you nothing but peace and love. And I will see you or hear from you in the near future. Thank you. So this concludes today's episode. If anything that was said today resonates with you or with someone in your circle that you want to share this episode with, and you want to share that information with me, please feel free to send me a message via email or my Facebook page. You can leave a like on the RSS feed that you are currently listening to me on. And just let me know how you feel, whether you like it or you don't like it. Any feedback to me is great feedback, because it shows that you're in tune to what I'm saying or what my guests are saying. And, it helps open up that dialogue. And I always like to hear other people's perspective on things that we've discussed. So thank you for joining me on this episode. And again, if you like the episode, join, subscribe, click how much you like it, and send me a message. The email address is dc@thesoulfuleclectic.com, and you can follow me on my social media. Currently, the Facebook page is up and running, and the Facebook page is called Soulful Eclectic. You have to drop the "th" on this one. And so whatever social media platform, website that you're listening to or you are following me on, please subscribe, rate the show, your thoughts. So until next time, take care of yourself, love yourself first, because if you can't love yourself, how are you going to love and care for anyone else, right? So with that, I bid you peace and love, and I will talk to you on the next episode. Namaste.